I'm Monique Bradley. I have whānau with type 2 diabetes and I've had pre-diabetes, so I understand the harm diabetes can cause. Today we're learning about how diabetes can affect our eyesight. This is particularly important here in Aotearoa, where diabetes is the leading cause of preventable blindness. Losing your sight can be very difficult to accept, especially when you're living with diabetes and much of your day-to-day life relies on your vision. Checking blood glucose levels, changing insulin pumps, or injecting yourself. Eye conditions that are linked to diabetes include cataracts, glaucoma, and diabetic retinopathy, which is the most common. All can lead to vision loss, but early diagnosis and treatment can go a long way towards protecting your eyesight. Symptoms of diabetes eye disease include blurry vision, seeing double, sore eyes, seeing spots or floaters, vision loss. If you notice any of these symptoms in between your routine eye tests, report them to your doctor or diabetes health specialist immediately. So what causes vision loss? People living with diabetes tend to have higher sugar levels in their blood. Over time, these levels can affect blood vessels all over the body, including the eyes. When blood vessels in your eyes are damaged, they can leak and bleed, causing vision loss. The good news is there are several steps you can take to reduce or even prevent your risk of diabetes eye damage. You can also stop it from getting worse if you already have it. A lot of these preventative steps are the same things you do to manage your diabetes. Monitor and manage your blood glucose levels. Maintain a healthy blood pressure. Maintain healthy cholesterol. If you smoke, get help to quit. Have an eye test at least every 2 years with your local optometrist or other eye doctor. Report any changes to your sight in between routine eye tests to your doctor. There are no symptoms in the early stages of diabetic retinopathy, meaning any changes can only be picked up by an eye test with an optometrist or ophthalmologist. When was your last eye test? To get a test, your doctor will first check your eyes before referring you to an optometrist, eye specialist, or the free diabetes retinal screening program. Today I'm here at Specsavers with experienced optometrist Seema Lal, who's going to talk us through the process of getting a diabetes eye check. Seema, do people often get anxious when they have an eye test?
Some people do, but a diabetes eye check is quick, easy and painless, so there's nothing to be worried about.
An eye health check is about much more than testing your vision to find out whether you need glasses. First, a diabetes eye check involves an expert using a machine such as an OCT or ocular coherence tomography machine to capture a 3D scan of your eye. This allows them to see the layers of your retina and check its overall health. Next, the tonoref machine tests the pressure of your eye to check for signs of other eye conditions by blowing a tiny puff of air. It's important to test the back of your eyes as well. The optometrist will use a slit lamp to give the back of each eye a good checking over, before moving on to the last check using a phoropter. People living with diabetes can also have different vision problems, so this machine helps determine what those are. If any issues are detected, your eye health professional will talk to you about treatment options or refer you to an ophthalmologist to confirm your diagnosis and prescribe treatment. Getting a diabetes eye check is that easy. So here's a summary of today's top tips from Diabetes New Zealand. Have a diabetes eye check at least every 2 years or as directed. Early detection and treatment can protect your vision. Keep your blood glucose, blood pressure and cholesterol levels at a healthy range. Report any rapid changes in your sight to your doctor. These include blurry vision, floaters and vision loss.